Dry eyes can actually be caused temporarily by having LASIK surgery. It's important when considering LASIK that you understand the basics of dry eye and let the surgeon know before he operates. We asked Dr. David Shanslin, a professor at the Shiley Eye Center at UC San Diego, about how LASIK surgery can affect dry eyes.
If you do not treat dry eye, and if your eye is extremely dry, then you may end up leading to surface problems of the eye, including new blood vessels growing into the surface of the eye itself. And these can eventually lead to blindness in severe cases. Of course, in most cases, it's not that severe, and patients are just left with irritation and symptoms of a gritty sensation in the eye.
Dr. Shanslin told us about the tear film and why it's important to the health and function of your eyes.
Well, the tear film is extremely important to the health and function of the eye. First of all, for the health of the eye, it provides a moisture covering of the surface of the eye, which without it, it would just dry up and you wouldn't be able to see. But functionally, the tear also provides the first part of the eye that starts to bend light rays. And so basically, it's the effective surface that causes light to come to focus on the retina. And if it's not working right, then you're not going to see right. Most patients who have mild forms of dry eye can have LASIK and can have a great result with that procedure. But some patients who have very severe forms of dry eye may end up with a worsening of that condition when they have LASIK. So it's really important to have a thorough eye evaluation to determine whether your eyes would tolerate the procedure of LASIK. And that, of course, should be done by your eye care physician.
We asked Dr. Shanslin if dry eye disease could affect the outcome of LASIK surgery.
If you have dry eye, it can affect the outcome of LASIK. It does that because the front surface of that tear lake that covers the eye is the most important refractive surface of the eye. So we've tried to reshape the eye with LASIK so the patient can see better, but if the tear is not there and doesn't coat properly, then you won't see as well. So it's very important for the function of the eye that you have an adequate amount of tear.
And we asked Dr. Shanslin if a patient has dry eye after LASIK, will it go away?
Almost all patients after having the procedure of LASIK produce less tear for a short period of time. Usually it takes about 90 days for the tear production to return to normal after a LASIK procedure. So a patient will experience a sensation that the eye is more dry, more irritated for about 90 days. And then most patients come back to the same state they were before the surgery. Pretty much all of these treatments come down to adding moisture with the proper kind of tear supplement that will coat the eye effectively and stopping the outflow of tears using devices like plugs so that we can provide an adequate coverage of the eye with an adequate tear film.
Thanks for watching this special edition of the American Health Journal. If you want more information about the topics or the doctors you've seen on this show, you can contact us at 800-303-3200. And now you can get the American Health Journal on your mobile phone. Check out our mobile app at ahjmobile.com. I'm Roger Cooper. Thanks for joining us for the American Health Journal.